name is Brooke. I'm here to show you today what to expect your first day at a new clinical site. And so as you can see, it's super important that you arrive in business casual clothing with both your hospital badge and your NSU student badge visible for both the security to see and also your patients to see. And then once you arrive, you'll go ahead and find the first hospital landline. It's super important that it's a hospital phone and not a cell phone. And there you'll go ahead and check in with your Chronotech code. And that's just your the system for you to check in, and all the staff and everyone knows that you've arrived at the site. Okay, so once you're clocked in at the front desk, you're gonna go ahead and find the scrub machine. And this varies at different hospitals. Some will have a machine and some will have just random size scrubs that you'll choose from. But it is imperative that before you enter the actual OR floor that you're covered. You're in the hospital scrubs, you have on a mask, you have on your bouffant, your cap, and then a bouffant just in case. And then some hospitals require shoe covers. It just depends on the site. And so once you're completely dressed, you're gonna make sure that you have everything that you need on you. That'll be of personal preference, whether it's a stethoscope or a notebook to keep notes. That varies by site and it's up to you. But once you're completely ready, then you're gonna go ahead and find the OR board. So let's grab my stethoscope, some paper to take notes on, and a pen. And then I also removed any jewelry that I was wearing just to be completely sterile. And so you're gonna go ahead and find the OR board. Again, this varies. Some could be on the computer, some can be handwritten or on whiteboards. And so what you'll do is every hospital is gonna have initials for their anesthesia providers. And so you'll just have a master key. So for example, JV could be a CRNA, CM could be an AA. And so you'd find the room with the with an AA available. And then so you'll see, okay, they're in room 3. And so you're gonna go ahead into a separate board, and it's gonna have each room by case. And so you'll see in room 3, there's gonna be a total knee arthroplasty. And so that way you know which case to go ahead and prepare for, and which drugs to drop, which tabletop equipment to have, and so forth. Okay, so once you find the OR that you'll be assigned to for the day, you're gonna come in, you're gonna turn on your machine to allow it to start up. And in the meantime, you're gonna set up your airway equipment. And so as you can see here, this is just a basic standard tabletop setup. So you'll have your tube, you'll have your blade and handle, a backup LMA, and some oral and nasal airways, as well as some tape, a temperature probe, and then any other equipment that you might need. And so as far as your airway check goes, you have to manually check the handle and the blade and make sure that the light works, which this one does. And then for your tube, you're gonna go ahead and make sure that your pilot balloon works and holds pressure. So you're gonna insert about 5 to 10 cc's of air. Make sure when you squeeze here that the balloon holds, and then when you squeeze here that the pilot cuff holds as well. So this one's ready to go. I'll go ahead and deflate that and leave it there. Backup blades, backup handles, and then just to the very least be familiar with your anesthesia cart so that if something did happen in an emergency, you know where the syringes are, you know where your drugs are, etc. And so now you can go ahead and follow the prompts on the machine. So we're gonna go ahead and do that. A lot of machines nowadays have self prompts, and so you're just gonna go ahead and tap through there. It'll do everything by itself. It'll explain to you what to do. You're gonna check your gases, make sure that they're full. If not, if you have access to, you're gonna refill them. If not, you'll just leave it out and fill it when your preceptor arrives. And then other things you can manually look for is look at your CO2 absorber, make sure that it's mostly white. If not, you need to change it out. You're gonna check your suction, and so you'll manually turn it on and then make sure that it occludes, which this one does, so it's working. And then you're gonna go ahead and check the high pressure circuit test. And so you're gonna do that by grabbing your circuit, and you can manually occlude, or you can, a lot of machines have spots that you can occlude it there. And so you're gonna go ahead, turn your APL up to anywhere around 30. You're gonna flush, and then if you look right here, you just wanna make sure that it holds where you set it. And then if you let go, that it stays for a few seconds. And then if you open your APL all the way, the rest will scavenge out. And you can't physically see it here because it's inside the machine, but if it had an actual scavenging bag, you would see it. And once that's ready to go, you're just gonna go ahead and optimize the room. So if you need any special equipment, whether that's a glide scope, an infusion pump, you're gonna get that ready. And then just for efficiency purposes, you're gonna, if you're with your EKG leads, you can just separate them and lay them across the bed. That way when the patient comes in and they roll them back, you can just quickly put the monitors on and then get ready for induction. On your site, some sites allow you to have Pyxis access where you can physically drop the drugs. If not, that's fine. You're still gonna prepare just a basic drug setup depending on the case. So for example, I have the total knee, so I know that there's most likely gonna be paralysis and of course sedation. And so I'll go ahead, grab a syringe, and then you'll put the corresponding sticker. And if you come closer, you can see that there's a slot. So this is propofol. It has the dosage on it, but you have to add in the date, the time, and your initials. And so, of course, you can't put the time yet, but you could put the date and your initials, assuming that you're going to be the one that draws it up once you get Pix's access. And so once you have your drug set up, or your syringes at least, then you're able to move on and meet the patient. Before you leave the OR, I would just do a general sweep, look at everything in its entirety, kind of go like section by section, just make sure that you have everything you need. And then similar to how I mentioned before about knowing where everything is, the Pyxis, we don't have one here, but it's gonna have, every drawer is gonna have different drugs. And I would spend time your first few days just opening the drawers and just really familiarizing yourself. You can look here at what drugs are where, and then of course how they work, because I can't even tell you how many times in clinic that there'll be an emergency situation and your preceptor or your attending is like, hand me this, and you have to know where it is. Like, there's just no way around it. And so I would spend time getting used to this. Of course, some are a little more organized than this, but you'll get the hang of it. Okay, and then lastly, before you go and meet the patient, I would go back to the board, make sure that nothing's switched, especially in larger hospitals. It's not uncommon for them to switch rooms around, switch preceptors, surgeries. And so if I go ahead and look, room 3, CM 3 still has a total knee, so we're all ready to go and meet the patient. So once you find the pre-op area, you're gonna go ahead and meet the patient, introduce yourself, let them know who you are, and then ask them some questions. I do want to keep in mind that these patients have been asked these questions by the nurses, by the anesthesiologist, by other members of the anesthesia care team. And so I think as students, it's best, it depends on the preceptor, but to keep it kind of short and sweet, ask the basic questions that you need, any pertinent follow-ups that you see in their notes. I do want to say again, this does depend on the preceptor and attending. Some sites depend on you to do the interview, so that of course is different, but some sites kind of want a abbreviated pre-op, that way you can be efficient and know just what the key points of the case are. Okay, so once I have the patient's chart, I'm gonna go ahead and meet the patient. So hi, my name is Brooke. I'm the anesthesiologist assistant student working with the anesthesia care team today. How are you feeling?
I'm doing good. I just have a little bit of pain.
Okay, that's what we're taking care of today. Do you mind if I see your name tag, please? I'm gonna confirm your name and date of birth. What's your name?
Samara.
Okay, and your date of birth?
It's 1/2/95.
Perfect, and then I'm gonna check your IV, make sure it's running. Okay, perfect. What brings you in today?
Well, I'm having surgery in my right knee because I fell and I broke my femur, I think.
Okay, have you had any surgeries in the past?
No, just my first one.
Okay, any known complications with your family in anesthesia?
I kind of have a little bit of asthma.
Okay, and aside from that, no problems with the anesthesia, maybe feeling nauseous that your family members know of?
Maybe
or
sometimes
any special
nausea,
conditions?
but I never really had anesthesia before.
Okay, do you take any medications?
No, just Advil sometimes for the pain.
Got it. And when was the last time you ate or drank anything?
Not till yesterday night.
Okay, anything this morning?
No.
Okay, did you have any questions regarding the anesthesia?
No, I think you did a really good job explaining.
Okay, and then now, like I mentioned before, it depends on the preceptor on how deep you want to go into their past physical history. And so for the abbreviated, you kind of just do an overall review of systems. And so as follows, I'll go ahead and show you. So I'm just going to ask you a few quick questions about your physical health. Any history of stroke or seizure?
No.
How about heart attack, high blood pressure, anything like that?
Not that I know of.
Okay, and for your lungs, I know you said you have asthma.
Yes.
Do you take an inhaler for that?
Oh, I haven't had an episode in a very long time.
About how long would you say?
I would say like childhood asthma.
Okay, any COPD, anything like that?
No.
No shortness of breath?
No.
Perfect. Any problems with your stomach, any GI problems, gastric reflux?
No, not that I know of.
Okay, and then as I mentioned before, it's really important that you ask them if there's anything that I forgot to ask, and then if they have any questions. So just to reiterate, any other conditions that I didn't mention, any parts of your past history that you'd like to bring forward?
No, actually you did, like I said, you did a really good, thorough job.
Okay, any questions about the anesthesia?
Can you explain how the anesthesia would work?
As a side note, it depends on the attending. I would ask them if they want you to explain the anesthesia or if they would like to. It is a kind of sensitive topic. Some people are a little more scared than others, and so you really have to be careful on how you deliver it. But for example, I'll show you how you can describe general anesthesia. And so your procedure today will be general, which means that you're going to be completely asleep. You won't feel anything, you won't hear anything, see anything. And we're going to place a breathing device that's going to help you breathe. And again, it'll be in after you fall asleep, out before you wake up, so you won't even know it's there. And we're going to give you a bunch of medications to help with any nausea or vomiting, any irritation. Your throat might be a little sore after, but that's completely normal. And aside from that, you shouldn't feel a thing, and you should be ready to go home as soon as the procedure is over.
Okay.
Since she mentioned she has a history of asthma, I'm gonna go ahead and take a listen to her lungs. So do you mind just taking a few deep breaths for me, please?
Okay.
Okay, in, out. Perfect. In, out, and then one more. In. All right, sounds good. And then lastly, I'm just gonna ask any follow-ups that I might have forgotten. And so I just want to confirm you have no known drug allergies?
No.
Okay, and then do you mind pulling down your mask for me real quick? Sticking out your tongue as far as you can. Can you turn your head side to side, up, down? Any discomfort?
No.
Perfect. All right, so you're ready to go. We'll go ahead and take you back soon.
Okay, thank you.
No problem. And when your preceptor arrives, just let them know. You can show them what you set up, but they'll be able to see it. They're gonna most likely check the circuit, make sure you checked it, and then just let them know what you learned about the patient. And more importantly, I would be excited to learn, but also be willing to learn. It's super important to be teachable. We're students, we don't know everything, and the odds are they know a lot more than us. And so just be willing, ask questions, but also take constructive criticism, and just be, a good student that's eager to learn and build in this profession. Thank you.